We'll now move on to the BJUI lecture. Now, for about a year, probably since about the day that England lost a football match in Iceland or to Iceland, as some of you will have realized, the world has become somewhat unpredictable. And I'm afraid that unpredictability has affected us politically as well. So David Pryor, who sits in the House of Lords and has spoken there on health matters and industry matters, and who is due to come and give this lecture today, has unfortunately had to pull out because of the results of the recent election and the consequences in terms of what's going on with the Queen's speech at the moment. That's the bad news, but the good news is that we managed to interrupt a plane back from the Gambia this morning and persuade James Dow, who's probably very, very well known to most of you, to come and step in and give a lecture in David's place. James probably needs no introduction, as I say. He has the chair of urology in Aberdeen. He's well known in Europe and indeed around the world, but he chairs the European Guidelines Office, and of course is very well known for his more charitable work in the Gambia, which is what he's going to talk to us about this morning. So James, thank you very much for the diversion. I promise you I will give you a glass of wine afterwards, and we look forward to your talk on philanthropy and the power of giving.
Good afternoon, everyone. Honored to be given the BJUI lecture, albeit as a second replacement off the bench with 5 minutes to go. Anyway, I thought I'll talk to you about at least my own journey, and it may not relate to you at all in terms of your own life and how you relate to your own vocation. But hopefully some of what I would say today might resonate with some of you. For some of you that don't know, I was born and bred in the Gambia, 100 degrees Fahrenheit all year round. Beautiful beaches, lovely people. Then I ended up in Aberdeen, right? It was a shock. It was minus something, it was like somebody opening a freezer, putting me in there with my suitcase and said, that's your life. That's how bad it was. I was 19 years old. And I was born to a wonderful father who was a philanthropist, a doctor, trained in Edinburgh and Dublin. And also an empowered woman, my mother, who trained as a teacher in London. And for an African man, I'm proud to say that everything that went around in the right direction in my house in those days, my mother gave my father the feeling that it was because of him, but actually we all knew it was because of my mother. However, I also endured witnessing my father telling us that he had no money for books, for shoes, for our school fees. Yet, when I go to his office, he was the director of medical services in the Gambia, I would witness long queues of women and their children coming out of his office with money for their own children, for books, for shoes, and for their school fees. And I resented that. But now, on reflection, I realize that it was because of my own ignorance and my own self-centeredness. And it was my first introduction to philanthropy. It was my first introduction to the understanding that in sub-Saharan Africa, women are the cornerstone of sustainable development rather than the men. Men like me, I would say, are perhaps not the best option for us in Africa in terms of development. I am the problem in Africa, I am part of the problem. I am sitting right here in Scotland, sitting here with you in Glasgow, overpaid, wonderful job, never went back home. The complete opposite to what my father was. In 2001, I was blessed to be taken back by a good friend of mine, George Fowlis, through the Eurolink program to go back and work in the Gambia. And I was hesitant, but he convinced me to go, and I trusted him, you see, and I did. I will also talk to you a little bit today about my preparation of my future journey. I've learned a lot in Aberdeen, and my good friend Sam McClinton is in the audience here. I've learned a lot of things in terms of philanthropy, in terms of being a good person. I've learned that in Aberdeen. I'll talk to you a little bit about the project that we're doing in the Gambia. When I first went in 2001 to the Gambia, I must say I was unprepared for the suffering, the environment in the hospital, the attitudes and culture of the health workers, the lack of basic equipment, supplies, the level of training that existed within health workers. And bottom line was, I was just not prepared. I'd never worked in the public health sector in Africa. I'd worked in the MRC unit in the Gambia before I came to Aberdeen, but that's like working in a British institution. Everything worked. So after my first experience with George Fowlis and others, I vowed I was never going to go back. And I said to my father, you know, you're a bigger person than I am. What you did, I cannot do. And he said to me, you know what, that's okay. You found your own path, and that's okay too. For some strange reason, I went back in 2002 with George Fowlis and others again. I was slightly better prepared because I wasn't as shocked as I was the year before. And I must say, at the end of a procedure in the afternoon, some hot afternoon, the nurse came into theater and said to me, there's somebody out there wanting to see you. And I said, sorry, I've had enough. It's been a long day, hot, no air conditioning, I'm going to the pub. She went out, said that to this patient, who then said, go and tell the doctor it's okay. I'll be here in the morning when he gets back. For some weird reason, I thought, you know what, let me just get off my high horse for a second, just go and see what this guy wanted. And this was a guy that we operated on the year before. He heard we're back, and he walked God knows how many kilometers just to come and shake a hand to say thank you, and then went back home. That's all he wanted from me, nothing else. We were also called once to say there was a big commotion in the ward, and when we asked what that was all about, this was a lady being beaten up by the husband because we had canceled her procedure, and he'd blamed her for the cancellation. And for me, as a Gambian, I was embarrassed because I was there with Europeans. So I was embarrassed that my own can be so, I suppose, difficult with the women. That's putting it mildly. I also witnessed emotionless loss of life of women during pregnancy and childbirth, where the women are dying like flies, and nobody cares. Nobody cares. But I'd found my calling. Along the way, from 2002 onwards, I learned many lessons in Aberdeen. I started to pay attention to things I never paid attention to. And I realized that actually there are disadvantaged people all over the world, not just in Africa. And if we look closely enough, there were disadvantaged people in Scotland surrounding us. And we spent, as Sam McClinton would vouch for, we spent 2 hours talking to our cancer patients in a hotel to ask them what we're doing very well and what we weren't doing so well, and having humored us for about 2 minutes flat about the things we were doing vaguely reasonably. They then went on for the rest of the 2 hours telling us about all the terrible things we were doing and all the things we weren't so good at. And having recovered from the shock, we actually realized that what they were saying was that actually we needed just, if we have a cancer, we know you do your best to cure us. The cancer surgeons will remove our cancer, fine. But actually, we needed better preparation for surgery, better information navigation, rather than just throwing information leaflets at them. They needed better support before, during, and after treatment. In effect, patients and their families wanted us to listen to them beyond a factory of just trying to cure them. So we embarked, of course, because the NHS had no money to help us do what we had to do to fix what they said they wanted fixed. So we embarked on partnering with patients, their families, the oil industry, construction industry, Rotary schools, big lottery, NHS Endowment Trust, etc. And we've, over the past 10 years, perhaps raised about $10 million, and we established a urological cancer care center that is co-located with the acute clinical services, that is manned by cancer specialist nurses, that patients and their families can come and get the new diagnosis there, spend as much time as they want in this center. We have body system where we partner them up with other patients who have been through similar experiences. We've, of course, got patients involved in the redesign of our services, etc. And I must say that the experiences of the UCAN charity, for me, has transformed how I see urological surgery, certainly in Aberdeen. And I saw UCAN in a different light, that this was a catalyst for change, because things we could not say in public, for example, trying to get the first robot to come to Scotland, we were barred from saying that. The chief executives of the hospitals in Scotland were barred from talking about the robot coming to Scotland. But the patients could talk about it. They could be vocal about it. And eventually, of course, in partnership with patients, the communities, and others, we did manage to get that robot to Scotland. And it wasn't about getting the robot. It was about the fact that through engagement with patients, actually, they accept that we have shortcomings. And where they can help, they can complement what we do. But what is my destiny? The 7 years of charitable work in the Gambia had achieved nothing sustainable, in my view. Things that I would have said I should have been part of achieving, I must say, if we're being honest to ourselves, we had failed. Yes, the patients we treated may have benefited, but we're still living long queues. The health system was still broken, and women were still dying every day. We'd only trained one urologist, a good man, but only one. That's nothing much to be proud of. But I'd hit a wall. I'd hit a wall in 2007 that if I hadn't done something different, I would have stopped going, because I couldn't live with myself going back to that same hospital. And every year I went, it was at least as bad as it was the year before. So we embarked on trying to figure out how we can stop begging, continuously begging for charity. That's all we're doing, begging for charity. How can we have a model where we provide quality care to the poor that is sustainable? Because healthcare is expensive wherever you go, even in sub-Saharan Africa. So we embarked on establishing the Horizons Trust, a UK arm and a Gambian arm, that will embark on a social enterprise business model whereby patients who can afford to pay will be charged for quality healthcare, and then the profits will be used through a trust to provide care for mothers and infants under 2 years old. In Africa, to this day, a mother dies every minute. It may mean nothing to some of us here, but a third of those mothers bleed to death. If one woman bled to death in Aberdeen, there'll be a national inquiry, right? But these women are just dying, and we're all quiet. A quarter of these women that die of infection. No woman through pregnancy and childbirth should be dying of infection. This is the reality of labor in some parts of sub-Saharan Africa, where the labor beds have blood caked on them, not been cleaned, for a number of women giving birth. My mother had 5 of us in sub-Saharan Africa, in the Gambia. She could have died 5 times over. So what is our vision? Our vision is to establish an international standard regional social enterprise hospital situated in the Gambia using a financially self-sustainable model, a model designed to provide improved access to good quality care for the poor and the rich, wealth redistribution through healthcare. Why is the model interesting? Because we have managed to bring philanthropists, private investors, international development banks, the Gambia government, the people of the Gambia to the same table, all as investors, stakeholders, all of them expecting a return, just a different currency of return. The private investors want money back. The philanthropic investors want social impact. The government wants to achieve their MDGs or their sustainable development goals. It's not going to be a massive center. It's going to be a reasonably small center, but has everything that currently we don't have in terms of diagnostics, in terms of surgical services, in terms of standards. The charitable side is already providing outreach services. We've already piloted training programs, regional training programs. We ran a World Gastroenterology-led training program with the MRC unit and Horizons and the Gambia government in 2014 that worked very well. And we had people travel from Nigeria, from Ghana, from Senegal, from Mauritania to the Gambia. And we had trainers from all sorts of places to come. So it is possible to actually do things of quality in sub-Saharan Africa. We needed to raise $27 million for this to work. We've secured $8.2 million from the African Development Bank. This is our continent's development bank. In 50 years of the African Development Bank's existence, this is their first funded social enterprise or private healthcare facility. The Islamic Development Bank have provided another $8.2 million, $6.4 million from private equity investors and $4 million from philanthropic investors. The philanthropic investors include Brussels Airlines, Serenity Holidays, individuals as philanthropists, Carl Storz, Rotary. Pins and Masons has provided all of the corporate legal services pro bono to this point. The Gambia government has given us land in a prime location. We've already started in the outreach area trying to clean out 6 of the large outreach childbirth facilities. This was funded by Brussels Airlines, and they brought their whole team, the CEO, the vice presidents, a lot of bikers, and they did a Bike for Africa ride from Senegal to the Gambia to raise money for Horizons to be able to do this work. And some of these outreach childbirth facilities have no reliable electricity, so they needed solar power put in. Some of the nurses were catching babies with the light from their mobile phones. Dreadful. Their sewage facilities were terrible. Clean water was problematic. They were washing blood-stained garments by hand. So through some of the funding from donors that we've received, we've, of course, upgraded these facilities, put decent industrial-type washing machines, just the basics you and I take for granted where we work. And, of course, you know, we've had a lot of support from WHO directors, from the British ambassador, really a lot of holding of hands to make this work. And eventually, 10 years on, we, just on Monday, hence I was in the Gambia, did the foundation stone laying for the actual hospital that we hope will then be able to generate profits and dividends that will go into the charitable trust. And we laid the foundation stone. It was a bit of a drama, of course, with the president and the cabinet, everyone else present. But for me, of course, it's the joy of hope. Of course, I see it as a bit of a burden that I, of course, have accepted, but it is a burden because people now expect. They now expect. And there was a time I was actually quite concerned about presidents being on Twitter. As you know, across the Atlantic, the tweets from the president perhaps are not so generous, but certainly the tweet from our president of the Gambia is perhaps gives me a little bit more hope that presidents can be reasonable and sensible and human. There was a time I was actually afraid of this burden, but I've soon realized that actually my fear is actually not real, because I should not be afraid of fear, or of failure rather. I shouldn't be afraid of that. What I should be afraid of is if I wasn't trying. And so I'm comfortable now with the expectation. I understand there is a huge challenge ahead in the Gambia, but the Gambia has only 1.8 million people. If we cannot fix the Gambia, we can fix nowhere else in sub-Saharan Africa. And so I walk with hope. And we all say, why am I bothering? I have a nice life in Aberdeen. Yes, I do. I have a beautiful wife. I have beautiful kids. I'm paid more than I could have ever imagined when I was in the Gambia. Why do I bother? Because first and foremost, I am a doctor. Yes, I'm a surgeon, but actually, I'm a doctor. And I took an oath to help the most vulnerable in our societies. We all did. To relieve sickness and suffering. And whatever happens in sub-Saharan Africa, it may seem far, but we are all connected. Ebola is an exemplar of the fact that what happens anywhere in the world impacts us. I think I've become a better person. I think I care better. I think I listen better. And I think we're part of a movement that gives the precious gift of hope to the women of the Gambia. And even if we were to fail, I'd rather be part of something that gives hope than to not be part of something at all. And this is what the minister said last year, that Horizons represents a once-in-a-national lifetime event that will outlive all of us. We are committed to this endeavor and proud to be working in partnership with Horizons as we move closer towards the Gambian dream of a long, happy, healthy future. I believe this young lady was operated on by Mike Bishop, if I'm not mistaken, did a fistula repair on her, and she came back the year later with a gift for Mike Bishop. All she could afford. But an incredible gift, a chicken, yeah? But this is something that came from her heart. But there is a price. There is a price. There is a price in terms of the impact on your life, on your family's life. My family have been long suffering, no doubt, along this journey. My mother, God rest her soul, my father, God rest his soul, would have loved to see the doors of this hospital open. They watched the process for about 8 years till they all died, till they both died. And I have regrets that I did not spend enough time with them. For all the times I've been in the Gambia in the past 8 years, I've chased this dream rather than spend precious time with my mother. I love my mother. I loved my mother. So there is a price. I do hope, wherever they may be, now, that they understand. I hope so. And I hope I don't let them down. So I think I'll stop here, Krishna. Thank you.
James, it's difficult to say anything after that, but thank you very much for a very impressive, very moving, and very stimulating talk. And all I can really say is that it's always better when politicians stay away and we can experience what we've just heard from you. So thank you very much for stepping in, and I'm very glad that, say, David couldn't come.